Hello, my name's Julie McCrossin. Welcome to this series of conversations with people who are working to improve clinical trials for everyone in our community. And this series is hosted by the GI Cancer Institute. In this episode, Madison Shakespeare, a Gadigal traditional owner and community advisory panel member with the GI Cancer Institute, AGITG, discusses cultural safety and the role of partnerships with First Nations health workers and community organisations. I've had the opportunity to visit the Albury-Wodonga-based Aboriginal Health Service, where many of their patients go to the local mainstream cancer treatment centre in the town for their treatment, and invariably they have an Aboriginal health worker who travels to the mainstream service with the cancer patient, often involved in picking them up, taking them home, and being a partner in understanding and communication, because obviously limited literacy can be an aspect for First Nations patients, as it can with all patients. And is that something, again, you'd encourage, that working in partnership with Aboriginal health services where they are available?
Absolutely. And humbly, it's not just about limited literacy, it's more about cultural safety. But I think that there is certainly something that is not contemplated is that of cultural loading. So that's where we will have contexts where we have Aboriginal healthcare workers, involved in diagnosis, treatment practices and processes with First Nation patients. But then there's the assumption that because there is an Aboriginal health worker involved in those contexts, that they will do all of it in terms of they will support all cultural aspects. And then there's perhaps less propensity for other non-Indigenous healthcare specialists and professionals to actually be involved in gaining deeper understanding of cultural needs of patients, looking at clinical trials. And I say this humbly with now almost 3 years experience researching randomized control trials from a university perspective, from a research perspective, that so often when you involve that one or two or even an Aboriginal healthcare organisation, a community controlled organisation, then, as I said, there seems to be less emphasis then on non-Indigenous practitioners gaining extra knowledge, extra understanding and education. And I think that is a huge gap, and that's something we need to overcome.